Hi and welcome to this video. My name is James O'Sullivan and I hope you find this video useful and helpful in your study or your understanding of the wonderful world of traditional Chinese medicine. This short video represents about 3 hours of contact lecture on this particular subject. Okay, let's take a look at the concept of blood according to the theory of traditional Chinese medicine. Blood is not exactly the same as the Western concept of blood. As with most translations from Chinese to English, the concept of blood according to the theory of TCM is slightly different. It's a form of qi. It's a denser and material form of qi. In fact, blood is inseparable from qi, where qi infuses life into blood because without qi, blood would be inert, unable to move. It wouldn't have any function or active function, so that the two are inseparable. In other words, qi gives life and movement to blood, and blood nourishes the organs that transform qi. Blood and yin qi, as we discussed in the previous lecture, are particularly close together as they flow together in the blood vessels. Blood is mostly derived from food essence or gu qi, which is transformed by the spleen. That is the Chinese spleen. In the Huang Di Nei Jing, in the 13th chapter of the Ling Shu, or miraculous pivot, we read that when the middle jiao receives food essence, it will transform into red fluid, which is called blood. In the 74th chapter of the same book, we see the statement, yin qi flows into the vessels to be transformed into blood. We discussed this yin qi in a previous module regarding qi. Blood is a part of yin and it houses and anchors or provides a safe harbor for shen. We will discuss this more deeply later on. There is a famous saying in Chinese medicine which states that qi is the commander of blood and blood is the mother of qi. Next, let's look at the creation or formation of blood according to the theory of traditional Chinese medicine. In TCM language or understanding of blood, we see the creation of blood according to two cycles that are dependent on each other. The first cycle is called post-heaven or postnatal cycle. Here we understand that food and liquids are ingested or taken into the stomach, where they are broken down. Next, we have an organ called P, which is loosely translated to spleen. The TCM spleen transforms or metabolizes this food into a form of qi called gu qi. This gu qi is transported up to the chest area or up into the upper jiao, where it is pushed by the lungs to the heart, which transforms it into blood. This transformation relies on the second cycle of blood, called the post-heaven or postnatal cycle. This begins in the kidneys, which store a vital substance called essence, or yuan qi or original qi, essential qi, as we discussed in a previous lecture. More about essence in the next lecture. Essence produces marrow, which produces bone marrow, and this produces blood. We need this essence to influence the quantity and quality of blood in the same way we need good DNA or genetics to influence quality of blood in Western minds or Western concept. Essence and blood may also transform into each other. The book Zhang's General Medicine states, if blood is not consumed, it turns into essence in the kidney. If essence does not leak out, it is transformed into blood in the liver. Taking food essence and kidney essence as the material basis, blood is formed by the functional activities of Zang Fu organs, such as the spleen, the stomach, the heart, lung, liver, and kidneys. After being formed, blood normally circulates in the vessels throughout the body and is acted upon jointly by the heart, liver, and spleen. The heart dominates the blood and blood vessels, and the propelling force of heart qi is the basis of blood circulation. The spleen qi controls blood and prevents extravasation or leakage of blood. The liver promotes the free flow of qi, stores blood and regulates its volume and circulation. The coordination of these three organs ensures continuous blood circulation in the vessels throughout the body. Dysfunction of any of them may cause abnormal blood circulation. Deficiency of heart qi, for instance, may lead to stagnation of heart blood. Dysfunction of the spleen in controlling blood may lead to bloody stools, blood in the urine, subcutaneous bleeding, for instance, bruising or easily bruising and that. Next, let's discuss the functions of our blood. Blood circulates throughout the body, passing through the 5 Zang and 6 Fu of the interior, and the skin, muscles, tendons, and bones on the exterior. In this way, blood nourishes and moistens the various tissues and organs of the body naturally. It is circulated by heart qi. Blood carries nourishing qi to all of the organs, muscles, tendons, and tissues. Qi motivates the movement of blood to achieve this. Pay attention in particular to its moistening function, because we can see this in many examples of clinical pictures that are present in our clinics. For example, liver blood in particular moistens the eyes, the sinews or tendons and ligaments, the hair and the skin. Heart blood moistens the tongue and nourishes the mind or the xian. The 22nd problem of Classic on medical problems generalizes this function of blood, saying that blood dominates nourishment and moisture. The nourishing and moistening function of blood manifests clearly in the movement of the eyes and the 4 limbs. According to the 10th chapter of the Su Wen or Simple Questions of the Huang Di Nei Jing, states, when the liver receives blood, it gives rise to vision. When the feet receive blood, they are capable of walking. When the palms receive blood, they are capable of holding. When the fingers receive blood, they are capable of grasping. The chapter of the Ling Shu says, when the blood is in harmony, the tendons and bones will be strong and the joints will function smoothly. Deficiency of blood may impair its nourishment and moistening function and give rise to symptoms such as impaired vision, dryness of the eyes, motor impairment of the joints, numbness of the 4 limbs, and dryness and itchiness of the skin. The words from all of these classics give real meaning to our modern textbooks. Let's explore the function of blood on the mind. Blood is the material foundation for mental activities. A sufficient blood supply ensures clear consciousness and vigorous spirit. One of the major functions of the blood is that it supports the mind, it houses the mind, it helps to anchor the mind, helping us to have clear thoughts and clear thinking. The 26th chapter of the Su Wen, or plain questions or simple questions, states, Qi and blood are the foundation for human mental activities. The 32nd chapter of the Ling Shu says, harmonious circulation of blood ensures a vigorous spirit. These quotations explain the close relationship between blood and mental activities. Deficiency of blood, therefore, may produce mental disorders or emotional disorders. An example is deficiency of heart or liver blood, which may result in mental restlessness with symptoms such as palpitations, insomnia, and dream-disturbed sleep. Telling us that when blood is deficient, the mind may become uneasy, it can explain anxiety or unclear thinking. We may have symptoms of vague anxiety, slight irritability, uneasiness, or an inability to fall asleep. When our patient presents with mental or emotional issues, we think, where is the blood involved in this clinical picture? We have many acupoints that nourish blood. Spleen 6, for instance, or Sanyin Jiao, is the commonly used point to nourish blood. Located on the inner leg, this is one of the most important acupoints in our selection of points. The images in these slides are just before naming the points for my posters, which are available to purchase from MagCloud. The link is provided below, especially my posters on the acupoints. Next, let's take a look at disharmonies of blood. First, again, we look at blood deficiency. Again, as in previous patterns of disharmony, I include many examples of signs and symptoms. A patient may not experience all of these. The syndrome of deficiency of blood occurs when there is insufficient blood or a deficiency of blood to nourish the Zang Fu and the meridians. They may experience pale complexion or face, pallor, pale lips, pale thin or dry tongue. There may be insomnia, especially where the person finds it difficult to fall asleep. They may have dizziness, vertigo, blurring of vision where liver blood fails to nourish the eyes, palpitations where heart blood fails to nourish itself. There may be numbness of the hands and feet, fatigue. Here we see that where we have a blood deficiency, we also see symptoms of qi deficiency. A blood deficiency can affect the whole body. The tongue may be pale with a thin coating and a pulse may be thin, weak and choppy. Choppy is the classic pulse quality for a blood deficiency, or thready. It is said to feel like a knife scraping bamboo, but more on pulses later on in this course. However, it's always best to learn about pulses, contact with a good teacher. After forming our diagnosis, the next stage of the process is formulating our principle of treatment. Here we use the language of the functions of the acupoints. For instance, in this pattern, we want to nourish blood, nourish the heart and spleen because of their strong influence on blood production. We also want to pacify the mind, not only in the case where we have symptoms of mental disharmony, such as insomnia, but also to prevent further deterioration of the pattern, or prevention in other words. We will also select a selection of points to treat this patient. I have chosen spleen 6, which strengthens the spleen, stomach 36, which also strengthens the spleen's function of blood production. Spleen 10, its Chinese name Shui Hai, translates to sea of blood. It is mostly used for gynecological issues originating from blood disharmony, deficiency, stasis and heat in the blood. I've also chosen Heart 7, which specifically nourishes heart blood. I would also use a point to calm or pacify the mind, such as Yin Tang. This is just one selection. However, other acupoints that have similar functions may be chosen. This syndrome is often due to weakness of the spleen and stomach. Hence, qi and blood have an insufficient source, or due to excessive blood loss, a hemorrhage for instance, or drastic emotional changes which consume yin blood. Deficiency of blood deprives the head, face and eyes of nourishment, causing dizziness, blurring of vision, pallor or sallow complexion and pale lips. Blood failing to nourish the heart may lead to disturbances of the mind. Palpitations and insomnia may appear. Numbness of the hands and feet originates from the lack of nourishment of the meridians and collaterals. The pale tongue is a result of the deficiency of blood depriving the tongue of nourishment, whilst the thready, choppy, thin pulse is a consequence of insufficient blood in the blood vessels. Let's discuss the clinical picture of blood stasis. Stagnation of blood, blood stasis, it refers to the accumulation of blood in a local area due to interference of the blood circulation or to extravasation, leaking of blood, like as in a bruise. Blood which has not been dispersed or immediately expelled from a fixed location in the body. The clinical picture of blood stasis will be one or more of the following symptoms. A stabbing pain that's fixed in location. This is unlike qi stagnation, where the pain tends to move. The pain may also be worse with pressure, again different from qi stagnation, where the pain tends to be helped by pressure, such as trigger point. and the complexion is dull in colour. There may also be tumours, cysts, or swellings of the organ. Ecchymosis. There may also be hemorrhage, for instance. The tongue may be purple or with purple spots, and the pulse is deep. It may also be choppy, or it may also be a little wiry, depending upon the cause or etiology of the blood stasis. Our principle of treatment would be to move blood, smoothen the flow of qi, because where qi goes, blood follows. I've also chosen a selection of points to treat this patient. We start with spleen 10, as mentioned above or before. Shui Hai, sea of blood, is an important point to treat blood stasis. Bladder 17 is the Hui meeting point for blood, useful for all blood conditions. The Hui meeting points are also called the 8 influential points or the gathering points, which are a special set of points which have a broad effect on their related areas. For instance, we have a Hui meeting point for each blood, qi, vessels, bones, and so on. I hope to do a lecture on these points a little bit later on in the course. I've also chosen spleen 8. This is a qi cleft point of the spleen, also called an accumulation point. These are where the qi and blood of a meridian pool. Spleen 8 is primarily activated to treat acute and painful menstrual issues due to blood stasis, clotting, fibroids, dysmenorrhea, irregular menstruation, or pain at or near joints of the body. I've chosen large intestine 16. This can be activated for blood stasis in the lungs and chronic issues related to blood stasis. Liver 3 is an excellent acupoint for promoting the smooth flow of qi. Where qi goes, blood follows. Pericardium 6, I use this for balance. For example, to have a point on the arms, and particularly if there was pain in the heart region. Pericardium 6 is also particularly good to pacify and calm the mind, which would be disturbed with this type of pain. This is just a selection. However, other acupoints which have similar functions may also be chosen. There are many causes of blood stasis, such as sprains and contusion, hemorrhage, retardation of qi circulation leading to retardation of blood circulation, deficiency of qi causing a weakness in the normal movement of blood, and invasion of the blood system by pathogenic cold or heat. Pain, which is the main symptom, occurs because of obstruction by stagnant blood. The pain is fixed in location and stabbing in nature. Accumulation of stagnant blood in the local areas forms masses or can form tumours, which have fixed positions and are firm on palpation. Obstruction of vessels by stagnant blood does not permit blood to circulate along the normal course and may induce hemorrhage. A hemorrhage of this sort occurs repeatedly and consists of purplish dark flow and may exhibit clots. Cold and heat, excess and deficiency may also be causative factors of stagnation of blood or blood stasis. Qi deficiency may cause blood stasis. When you don't have enough qi to motivate the circulation of blood, it may stagnate. A qi stagnation may also cause a blood stasis. This is a worsening of the qi stagnation condition. In life, nothing stays the same. It either heals, it gets worse, or it changes into something else. A blood stasis may also develop from a trauma, just like a bruise, for example. Our next pattern is heat in the blood. Syndrome of heat in the blood refers to the syndrome which results either from endogenous heat in the blood system or from invasion of blood system by exogenous pathogenic heat. Endogenous heat usually occurs from internal heat generated by disharmony of some of the organs, particularly the liver. The clinical manifestations for heat in the blood would be mental restlessness or mania in severe cases, Hyperactivity of heat in the blood disturbs the mind and results in mental restlessness or even mania in severe cases. A dry mouth with no desire to drink. Consumption of yin blood leads to a dry mouth, but since heat is not in the qi system, the patient does not want to drink. Possible occurrence of various hemorrhagic syndromes, profuse menstrual flow in women, hyperactive heat in the blood system easily causes injury of the blood vessels and results, which includes nosebleeds and so on, profuse mental flow in women. A deep red tongue, rapid pulse. Excessive heat accelerates blood circulation and hence a deep red tongue and a rapid pulse appear. In skin problems where the person scratches, bleeding occurs. Our principle of treatment is very straightforward. Simply cool the blood. Chosen a number of points for this. I've chosen bladder 17 as the Hui meeting point for blood. It's the influential point for blood. I've chosen spleen 10. As before, it's an important point to cool the blood. I've chosen bladder 20. Bladder 20 is the back shoe point for the spleen and would be indicated for blood in the stools, blood in the urine, vomiting blood, all signs of heat in the blood. I've chosen large intestine 11 for its heat clearing and cooling blood functions. This point is particularly beneficial to clear heat in many heat conditions. And I've chosen spleen 6 again for its overall effect on blood, nourishment of yin, which has a cooling aspect on the body. This is just a selection. However, other acupoints that have similar functions may be chosen. Generally, treatment of heat in the blood would be based on the TCM patterns that include heat in the blood, instead of selecting points by function alone. Acupuncture and moxibustion may regulate qi in blood. As stated in the first chapter of the Ling Shu, fine needles are applied to clear obstructions in meridians and collaterals and to regulate qi in blood. Another medical classic, the precious supplementary prescriptions, holds that all diseases start from stagnation of qi in blood. Needling may promote smooth circulation of qi in blood. In acupuncture clinics, suitable points are selected and different techniques of needling and moxibustion are adopted to regulate qi in blood and to restore their harmonious states. Although qi in blood and body fluid have their respective natures, they coordinate with, promote and restrain each other in their functional activities. Their close and complicated relationships often manifest in physiology and pathology and are important in determining treatment on the basis of differentiation of syndromes. Both qi and blood are the material foundation for the functional activities of the body. They originate from food essence and from essential yuan qi of the kidneys, and their production depends on the functional activities of the lung, spleen and kidneys. Qi mainly provides warmth and motive force, whilst blood provides nourishment and moisture. Qi is considered to be yang, while blood is considered to be yin. This relationship may be summarized by the statement, qi is the commander of blood and blood is the mother of yin. Qi is the commander of blood, meaning that blood cannot be separated from qi in its formation and circulation, and blood nourishes qi. In other words, qi gives life and movement to blood. Blood nourishes the organs which produce qi. Qi and blood are inseparable in the same way that we cannot have yin without yang. There are 4 aspects of the qi and blood relationship. Qi generates blood by transforming food essence into gu qi, which is the basis or foundation for blood. Qi moves blood because qi is the motive force for blood to flow, which is the meaning of those famous sayings, where qi goes, blood follows, and if qi stagnates, blood congeals. Qi holds the blood in the vessels, preventing hemorrhage. This is especially true for the spleen's function of holding the blood in the blood vessels. And blood nourishes qi. Qi needs the nourishing qualities of blood, which in turn provides a dense material preventing Qi from floating, as we discussed in a previous video. We leave this lesson, and I hope you enjoyed it and found it useful. Oh, and don't forget to have a look at my posters if you would like to support these and future videos. They're not expensive. They're perfect size for most clinics today. They are very detailed and excellent for student, practitioner and clinic. I want to thank you for watching, listening, learning, hopefully. Don't forget to connect with me along all of the various social media. Have a look around under my Chinese nickname, which is called Jiamo Shi. Thank you, and wishing you well in your study and practice. Sláinte, which is Gaelic for wishing you good health.